Welcome back, everybody, to the Therapist Confidential podcast. And today you get to ask a therapist anything or three therapists anything. I have two of my friends and colleagues back on the show today. Clayton Norman, you may have heard him on episode 3, Weird Therapy. Welcome back, Clayton. Is your therapy weird?
Some seem to think it is. Yeah.
Some say it is so. Very good. Welcome back. I'm glad you're here. And then the 5th episode, Dr. Lisa Forbes. Is this even working? Patience, process, and patterns in play therapy. Welcome back.
Thanks. I still don't know if it's working.
You still don't know if it's working.
I'm not sure anybody really knows.
Okay. How do you know if therapy is working?
Well, we were just talking about play therapy. So there's the clinical sense. There's shifts in the story that lets me know things are changing and moving. And then when parents report behaviors are improving or things are happening differently at home, that lets me know it's working. I think it's a little different for play therapy than adult therapy. I think for me, understanding how it's working in adult therapy is much harder than for play therapy. So I don't know. I feel like it's asking the client if it's working.
That's super interesting. What do you notice about adult clients? Why do you think that's harder to notice if it's working or not?
I I don't know. Maybe I feel like people individually have a hard time noticing when things are changing. Like they'll report something to us and we're like, "Whoa," and they don't see it. So maybe the parents are not the individual I'm seeing and so they can see the changes differently.
Interesting.
Mhm.
And honestly, I think working with adults is harder because I think problems and problematic stories are more deeply ingrained. And so it just is way more complex to unravel. And with kids, things are just happening in their lives. And so I feel like it's a more simple route to changing things and resolving things.
Yeah, Clayton, I want to get your take on this. What you just said, Lisa, is interesting to me because myself and Tom Carlson and some colleagues have been playing with this term outsight. We say insight all the time, but with adults, especially, maybe with children too, this is what we're trying to do on some level, but we're trying to help them get outsight, which is to actually get outside of themselves and witness what's happening, right? And that's hard to do. And when you just mentioned that the parents are, I would assume, almost always a part of play therapy or working with kids, for example, that there is a place of outside, although that's complicated too, because it isn't necessarily the outside of the child. And sometimes, as we talked about in your episode, even Lisa, the stories that the parents might be reproducing can sometimes be challenging. All right, Clayton, how do you know therapy's working?
Okay. Well, I asked that exact same question a lot, and I find it difficult to know when therapy is working and can even second guess the process. But times where I have felt like, oh, I at least think this is working have been when the client reports it. And so sometimes when the goal is really tangible, but sometimes it can be very open ended, and that's harder to tell, quote, if it's working. But when the goal is really tangible, such as I am not wanting to drink anymore, right? And I've had experiences where a client has shared in the past, when I had this feeling, I would have immediately gone to drinking, but I didn't this time. And this is why. And it's based off of things that we practice in session, like being with difficult feelings and actually being able to meet them and be with them rather than run. And they can come back to therapy and report that, and they're proud of themselves. Those are moments where I feel like, oh, maybe this is working, and I get that's encouraging. And then there's a lot of times that feel ambiguous and difficult to identify. So I would say based on the client's report.
Yeah, that's the direction I tend to go as well. I know there are other therapists that feel different. And then, yeah, there are those clients we're working with that it just feels like you're out at sea someplace. You know what
Mhm.
I mean? And you're not quite sure where you're going. Sometimes it does move into a place where it feels like something's working, but I do rely disproportionately on the client's report of what's happening to have some sense of if it's working or not. I mean, I wrote a whole dissertation about that. And I find it interesting that, I mean that literally, by the way, that was my doctoral dissertation, like the difference between client accounts and therapist accounts of why change is happening. And I always find it, or if change is even happening, I always find it interesting because sometimes you'll talk to therapists. Like if you get a chance to talk to both therapists and clients, and as a supervisor, sometimes you do. Therapists will often report they're like, in session 4, I had this intervention where I challenged the irrational belief and everything, whatever the hell it is, whatever their theory of change is. I'm picking on CBT there, but it could be narrative or anything else. And, they have this whole professional story about why it's changed. And then you ask clients and they're like, oh, you didn't judge me. Or remember you said this one thing. Does this ever happen to either of you? They're like, oh, you said this one thing, and they say this thing. And I'm like, I kind of remember saying that. Or I didn't even see it as consequential, right? But to them, it changed their life, apparently. Have y'all experienced that where there's a little bit of a dissonance between like what you think might be happening and why something's working and how the client's perceiving it differently?
There's moments where I feel like I'm being ineffective or that I feel a little bit lost at sea and second guess myself. And then a client might return and say, gosh, this thing from last session really stuck with me and that was really helpful this week. And I'll think like, oh, really? Because I was completely second guessing myself that day. So that experience happens for me and has happened a lot, I think, actually.
Yeah, that's happened to me before. Of it, I just remember those times of being like shocked to hear what was meaningful to them, and I didn't. There was other sessions I thought were meaningful, and they weren't as much. So I think that happens. But so I see this with my students a lot that I train in our clinic. They'll be doing all these interventions in the room and kinda having an idea of what is effective and what direction to go, and then they're like, "Yeah, I don't know if any of this is helping," and I'm like, "Why don't you ask the client?" And it's like, like, I'd never thought of that. And then they go and ask the client, and it's always this tiny little thing that happened quickly, couple sessions ago that the counselor didn't even realize was impactful, so I think asking the client is useful, and I don't know, sometimes the weird part of this work one of the weird parts of this work is sometimes we just will never know. Sometimes I think of therapy as, like, episodes of care throughout our life if people choose to continue and go. I don't think it's a one-stop shop, and so sometimes I think an episode of care of therapy might just be getting people to come back to therapy. Like, "Oh, that was actually not so bad. I got to talk about things." I'd go back, and then later there's some insights that come. And sometimes I think of therapy as, like, planting a seed, and so sometimes maybe clients aren't in a place where they feel ready to hear that and grow from it or understand the insight. But then later on, I've heard so many people say, I saw a therapist when I was a kid or in my 20s, and they said this thing, and at the time I didn't get it or it didn't mean anything to me, but I kept thinking about it, and now it's like changed my life. And then that therapist will never know if they were effective with that client. So I think sometimes that happens too.
Yeah, this is an interesting profession in that we often don't know about the final outcomes. I also love that phrase, episodes of care. I think that's a really useful way of thinking about it. Okay, let me get into now some of the listener questions. I'm just going to fire these out and we'll see where they go. And we didn't rehearse these ahead of time. We don't know where this is going to go, which is the best part. All right, how about this one? Does the feeling of imposter syndrome ever go away? I hear this one a lot from students, often who feel like they're imposters.
Mhm.
Does the imposter syndrome ever go away?
I wonder, what do we mean when we say imposter syndrome? And because that phrase gets used a lot and then it kind of just becomes a phrase. And so I'd like to kind of start there. And I think many therapists and people would have different definitions of that. But I get this sense of imposter syndrome means I'm fake, I'm not good enough, I'm pretending, I don't know what I'm doing. And maybe this is a little bit CBT or a little bit connected to mindfulness, but my thought is, what's the feeling underneath that? Maybe I'm being challenged. I feel a little bit stuck. I'm a little bit fearful. And like with imposter syndrome, I actually question, should we ever fully know what we're doing? Should we be fully confident? Because that almost seems like a concern to me too. And so I think that this line of work is built on meeting our own growth edges as therapists and stepping into unknowns and stepping into fear, and that's going to bring up challenging feelings. So I think those feelings should be there, that we should not arrive at this place of fully knowing what we're doing. And so I think it's always there, but I would lean towards getting rid of the term imposter syndrome and working on identifying the feelings that are arising underneath that term. That's how I would approach that in my own work and how I do approach that. Because I feel that on a daily basis. Like, what am I doing a good job? What am I doing? Um, yeah, I'll start there.
Yeah, I often wonder, what are the stories underneath that phrase, imposter syndrome? And because I wonder that, I inquire about that with usually students, and I find there are all sorts of different stories that are at work underneath that, and some of them can be very similar and some can be very different, to your point. All right, Lisa, can you solve this for us? Does the feeling of imposter syndrome ever go away?
I don't have solutions to anything, just to let you know up front.
How disappointing. I mean, like, isn't that what we're supposed to be doing here? We're supposed to be solving, the big problems, like, how do you move through imposter syndrome? You don't have any answers to this. Okay.
Um, you'll be very disappointed. Um, I don't know. I agree with everything Clayton said. I think it looks different for different people, and different people have different intensities of it based on, the context, their history. I like the idea of looking for the story behind it. Um, I think there are ways for it to decrease and become less intense. I mean, I think when I think of imposter syndrome, I also ask, like, what does that mean to the person? How is that showing up for them? How do they experience it? But I kind of think of it as an issue of belonging and competence. And so if you think about a career, you get more experience over your career. Generally speaking, we tend to feel more competent, sometimes getting more experience. Sometimes I feel like maybe I become less sure of what I'm doing. But I think sometimes it can decrease with just experience, feeling more like you know what you're doing, you've seen these situations before. But the belonging piece of it is interesting to me because I don't know, I'm really big in people finding their I don't really love the word authentic, but finding their more authentic selves in the work that they do. And so I kind of see it as this imposter syndrome decreasing when we find belonging. And so for me, belonging is finding your own path, creating your own thing, and not like we have to do things completely different because everything's built on everything else, but something that's your own and you're passionate about and not just something that you're repeating. So I think if we're trying to exist within other people's structures and other people's ideas of how things work, then yeah, I think we'll always kind of feel like an imposter. But I think if we can find our own path that meaningful for us and we believe in, then I think that kind of goes away in a sense.
I love
Yeah,
that.
I really identify with the latter part of that, you know? I To be honest, even as a student, that phrase, this is 20 plus years ago, imposter syndrome didn't make sense to me because, like, am I an imposter because I'm existing in a system that wasn't made for me or what I'm doing? Does that make me an imposter? It doesn't make me an imposter. It means that there's a system trying to force me into doing the work in a particular set of ways, right? And I understand how that can feel like we're imposters, but I don't think I'm actually an imposter for doing that, right? And we're made to feel like imposters sometimes. And actually, making people feel like outcasts or imposters is a great way to aid conformity and get people to get in line. Because who wants to be an imposter or whatever else we might get called, unprofessional or these other terms, right? That'll get people to get in alignment quick and do this the way that you're supposed to do it. And Lisa, you were alluding to this. I mean, yeah, perhaps there are, of course, baseline competencies that we should all achieve, but I think there are very different ways that we can go about that. Something Clayton said was interesting to me too, like, maybe if we start to feel too confident in what we're doing, that's dangerous. I totally agree. And actually, I've noticed this in various different aspects of my life that when I was younger, I'd start to feel confident in something and I'd be like, "Ooh, I've got it." Whether that was parenting or therapy, like, "Ooh, I've got this." And of course, I never had it because that's not the nature of how most things in the world work. Something shifts or changes, right? And so now I've reached this point where it's like, if I start to have a feeling like, "Ooh, I've got it," I usually stop and I'm like, "Uh-oh, what are you missing?" Like in therapy, I do that often. Like when I have a number of good sessions in succession or something with someone, or maybe even with multiple someones, and then I'm like, yeah, I got it. And I used to ride that wave, 15 years ago, very differently than I do now. Because now I pause and I'm like, uh-oh, be careful, dude. You might be missing something. Anything else on this imposter syndrome before we move on to another question?
Yeah, I liked the part that you talked about the system wasn't made for you, so of course you're not gonna feel like you belong. I think that's an important part of it. I don't know, I wonder if there's a relationship between levels of imposter syndrome and willingness to step outside the box.
Meaning that, like, that the more that you step outside the box, the more likely certain personalities are to feel as though they're imposters.
I could see it going either way. Like,
Yeah,
I
it kind of
it
is the other way.
yeah, I meant it the other way.
Oh, interesting.
It either way, like, yeah, if you step outside the box, you're gonna be perceived as not doing it right or well or whatever. So I guess that could bring on some feelings of like, I don't belong or I'm an imposter, but I kinda meant it the other way. Like, if you feel like you have to fit into a system and you can't challenge that system, but that system doesn't work for you, then of course you're gonna feel like an imposter. But I wonder if people who are like, yeah, that system sucks and it doesn't fit for me, so I'm gonna do this other thing, I'm gonna try this other way and kind of push the boundaries. I don't know. I wonder if that kind of gives a sense of freedom that you don't have to fit a certain mold.
I relate to that strongly in my work, and I've mentioned on previous podcasts I do with you, Travis, that I do a lot of creative approaches to therapy. I take clients bird watching. I take adolescents skateboarding, and those are things that are very authentic to me. And you use that word, Lisa. And so I don't feel like an imposter in those environments. And I think I've had sessions that feel very strong and connective and have been encouraging and affirming that I want to keep doing that work. But I have felt like an imposter when I've tried to fit into another model where I left my authenticity behind. And I actually think about sometimes, especially when I first started, I was really feeling like an imposter, really feeling not good enough. So I took so many trainings and read so many books and was just like, I have to figure out how to do this. I was stumbling, fumbling, and I felt like an imposter. And so I think that that word authenticity to me feels like maybe the opposite of imposter or imposter syndrome of like, it's gonna take time, we have to be patient with ourselves, I think, but finding our own authentic voice to me seems like the counter to imposter syndrome.
I also think it's like, who are the exemplars that we're exposed to? So like once we can find sometimes people who have done it longer than us that do it in a way we can identify with, right? And maybe we can identify with them culturally. Maybe we can identify with them almost in the spirit of how they do their work, whatever it is, right? But once we find those exemplars, I think then it at least opens the door to feel less like an imposter. All right, next question. Why can't I hug a client?
What do you got, Lisa?
Clayton's deferring early on.
Deferring, I'm deferring.
Good work. Lisa, why can't I hug a client? I think the question might be, why can't we as therapists, right, hug clients?
Well, I think it's complicated. I think, first of all, what tells you you can't, because I don't think it's that definitive. I've hugged clients before sometimes.
Gasp.
Don't take my license. I feel like situations are always different, but I do feel probably that message is sent in training programs sometimes. And I think it's a boundary thing. We have to have boundaries and the hierarchy and the power of the relationship and that there's some real things there. That's why we can't have relationships with our clients is because there's this huge power differential. So I do think there's some boundaries and power that we need to be respectful of, but
Mhm.
I also think we're humans. And so if a human needs a hug, I don't understand what's wrong about that. I just think it's kind of silly when we give very black and white definitive mandates to people. That's always been problematic for me. So I don't know that it's that we can't, but I think we've been taught not to and to fear it because of maybe it's more about litigation.
I suspect that you're probably right, and I see this question morphing, and I appreciate the question, the original question, "Why can't I hug a client?" Maybe morphing into a little bit of a question of, like, what are the contexts and circumstances I should be aware of around potentially hugging a client? Clayton, I'm wondering your relationships with hugs and therapy.
Yeah, well, I'll say that I give my therapist a hug, and I asked that. So that came from me as the client. I've met with my therapist for many years. I feel like a pretty strong bond, and I just, "Hey, can I give you a hug?" And he said yes, and it's been fine, and that's been going on for about a year. It doesn't seem like anything of consequence. I don't even think about it. But I do think that there's just different things to consider, and one is maybe if the client asks for it rather than the therapist doing it, I wouldn't just initiate that. But if a client asks for it and just checking in with myself, is there any concern that is arising around this? And if there isn't, I feel okay with that. It's not something I actually do with clients much. I've only had maybe 1 or 2 clients ever ask that, but I'm not gonna initiate it. So that's my thoughts on it.
I appreciate these thoughts. I have hugged clients before. It's not something I do as a common practice. I think there's something else that underlies this. Lisa mentioned litigation. I think it's along those lines, which is sexual attraction. And this is something we won't talk about very often, right? I mean, as a group of therapists, I mean, we kind of allude to it in graduate school, at least it was sort of alluded to, like, don't have sex with your clients. And there's this idea that a hug could be sexual or a worry that it could be. And the thing that's complicated about that is it could be, right? And so that's why, like, the idea of context is super important. Also, we work with people who sometimes have had sexual trauma. And so thinking about touch, a hug being a very prominent and specific type of touch. And would this even serve someone? I mean, so there's so many variables to consider. So I agree, the idea of like just going around and hugging clients, I don't think anyone's advocating for that. And also, I appreciate what Lisa said, where there's a very human aspect to this work too. There's another word that comes to mind that seems important when thinking about hugging, which is consent, right? And do we have consent? And by the way, I feel like just in the world outside of therapy, that would be nice sometimes. Like, I don't just go around hugging people, you know what I mean? Even people that I might have a relationship with, a friendship or a colleagueship with, I would ask before I hug them, right? And so I think sometimes just in the culture, we don't always navigate that all that well with regard to hugs. And I think there's even more layers of potential complication there. But to deny someone a hug or some other sort of basic human touch, I guess, in a moment where they're really suffering, that could also be not very therapeutic and actively harmful. So I think it's really complicated to think about. But I for one wouldn't say that there's a prohibition against hugging clients, although I have heard people say that, and perhaps there's merit to that approach as well. I think it's complicated. Next question. Hmm, I like this one.
Mhm.
Will healing ever be 100%? It's an interesting question because I think what I hear in that question, will healing ever be 100%? Like, whatever people are struggling with that they come to see us with, will that ever be solved? Will it ever be to a place where it's like, I am no longer bothered by this distress or this, the psychologized term is trauma, whatever it is that I came to see you with? So what do you think? Will healing ever be 100%?
It's really tricky because it gets into, like, defining what healing exactly is, what 100% completion of healing means. But my hunch is actually to say no, because I do view healing as an ongoing process and like one of our almost natural states. And that's easier for me to think about when I think of a physical wound, like a scab or something, like the body just heals. I guess that can be fully healed. But I think of healing as always available, like it's an active, ongoing, innate process, which makes me think that there isn't this completed, okay, that's completed and done and kind of closed off now. So I just think of it as ongoing, which makes me hesitant to say that 100% is reachable.
Hmm. I agree. I don't know. I just keep thinking of our obsession with healing and neoliberalism and improving ourselves and becoming stronger and better than healing is like some product that you can pay for, and capitalism in there too. I kind of wonder, is it okay not to heal fully? Is it something we're afraid to have happen, not healing fully? So I think there's some issues around that, but I
Mm.
think I agree with Clayton. Your example of the wound, we can heal a wound, but there's still going to be a scar and there's still going to be reminders of it, whatever it is. So I don't know that it ever gets 100% healed. And I don't know, like I said earlier, I think of therapy as episodes of care if somebody chooses to continue to go throughout their life. And so if there's a certain experience somebody had that they want to heal, I think those episodes of care kind of look at it from different angles, and you're at different moments of your life, different places of your life, and so you can see it differently, you have different perspectives on it. So, I think we look at it in different ways, but it's never like this 100% resolved, cured thing. I think it's about having a different relationship to that thing and seeing yourself differently in relation to it and becoming, I don't know, I'm all about freedom right now, autonomy. And so maybe that's it, just feeling more free from whatever it is that has burdened you.
Yeah, Lisa used the exact phrase that I often think about with these sorts of things. How are we in relationship to systems? How are we in relationship to people? How are we in relationship to events? And yeah, we can, I think, alter that relationship. Can we ever be 100% healed? I won't say no. Maybe some people do. I don't know that I've seen that. I don't know that I've experienced it in my own life or that I've seen it with someone I've worked with. 100%, that's like such a high bar. I don't know. And then of course, people that know me will be surprised to hear this, but I very much identify with what Lisa was saying about the neoliberal aspect of this. And I think it cuts both ways. I think sometimes clients feel like they have to heal 100%. The culture makes them feel like if they haven't healed 100%, they're problematic. And also, hey, I paid money for this shit, you know? Like, I need to heal 100%. What's going on? There's a whole neoliberal aspect there. And I think this neoliberal aspect impacts therapists too. Like, if I'm not helping them heal 100%, I haven't done the job,
Mhm.
right? And I also think there's an element of this that can sometimes be influenced by psychology and therapy's alignment with the medical model, where there are certain medical ailments that can be healed 100%. Absolutely. Now, someone can have something like cancer and it can go into remission and come back, of course. In some ways, I think that's a little bit of a better metaphor for therapy than the things that can just be healed. But like Lisa said, even physical healing, you might have a scar. If you had a broken bone, there might be some sort of, minor deformity or something that has happened as a result of that. You're different than you were before. But I think there's this pressure to heal 100%, and therapists feel that pressure. Like, if I'm not doing this, I'm not giving them their money's worth. But I want to entertain the idea that maybe healing could happen 100%. But I don't think it's happened for me in my life, and I don't think that I've seen it happen for others. Any other
I
thoughts on this? Oh, Clayton, go for it.
I also wonder, just the idea of 100% to me almost sounds like, okay, that experience is done and it's put away now. And I wonder if healing actually might be more beneficial at like 90% and leaving a little bit of that past there. I'm actually thinking about a poem that a client brought in, and I don't have the poem with me right now. I don't remember all of it, but it was a poem by Mary Oliver. And a client read it to me in session, and it had a line in there about Mary Oliver telling this story about something sad. And then it said, I tell you this to break your heart so that it never closes again. Or something like that. Like a little bit of this break, a little bit of this hurt, this tenderness, this sensitivity that came from the initial maybe experience or trauma. We want to heal a lot of that, but maybe a little break in there is actually gives us a little bit of wisdom or more tenderness for the rest of the world. And maybe fully healing is not the end goal. I don't know. I'm just kind of questioning the idea of 100%.
I like that. Maybe that's not the end goal. And you're like, maybe if we heal 90%, I wonder if that 10% has purpose and wisdom to it. And if it was gone, would we lose that purpose and wisdom? I think of like even really awful things we've been through in our life impact us in positive ways. Sometimes we gain insight or we gain an understanding of the world or we gain empathy for people. I think we make meaning from those experiences that kind of make living worthwhile in some ways. I think of like existential death anxiety. If we're more aware of dying and we think about it and we consider it, I think it helps us live in a way that is more meaningful because we're aware of it. It's going to happen and something that we're mindful of. And so I wonder if that 10% lingering, if we had to put percentages to it, would help us actually live differently and more meaningfully.
I think we're kind of calling into question the 100% and what does it even mean to heal? Like, what does that entail? What does it look like? How does it play out over time? And I don't know that there are easy answers to these questions. I go back to kind of where we started in speaking to the people we're working with, quote unquote clients, right? And their experiences of healing, the wisdom that they have around healing, the collective wisdom that maybe comes around healing from their ancestors or their communities. And we can learn a lot about healing practices there. So I very much am interested in healing practices, but I don't ever feel like the goal for me now, sure, when I was younger, just starting in this field, I was like, yeah, I got to help people get wherever they want to go, right? And I was a mediocre therapist for a long time as a result of that, and probably a combination of other factors where it was like, oh gosh, I got to have a prescription, I got to hit them with it, and then they got to see me as helping to cure them, right? And of course, the longer I've done this work, the more I found out it just doesn't really work that way, you know?
One last thing I was thinking about that is I wonder if that expectation of healing 100% almost makes therapy less effective. Because if that's the pressure, we're never gonna get there, and then it like you said, it also puts pressure on the therapist. I was working with this kid, probably 13 years old, and she just seemed like she did not wanna be there, although she was the one that begged her parents to come, and so I just asked one time, like, "What's going on? Didn't you wanted to come, but it doesn't seem like you wanna come." She's like, "I thought you were gonna give me a magic pill and everything would be better." And I'm like, "Oh, yeah, that's not what therapy is." So then we talked about it, and then she could access therapy differently. So maybe if the expectation is healing 100%, maybe that's limiting our ability to heal and to help.
Yes, and then what are the sort of pop cultural expectations, on TikTok and all the things about what therapy is supposed to be and what it's not supposed to be? What are the professionalized expectations? I know you're laughing at me. I got TikTok, right? I know TikTok. I'm hip. What are the professionalized expectations about what we're supposed to be doing or not doing? And sometimes there are checklists and all these things. And what if people aren't getting better and then we feel like failures? Boy, those dynamics can be really troublesome and can get in the way, I think, of healing or whatever the work we're trying to do is. There's so much pressure that's created around outcome and expectations and all of that. And it can be a lot. All right. How about this one? I don't know if this one came from a therapist. It might be from a therapist, but I know we have people who are not therapists that listen to the show. Whoever wrote it, I think it's an interesting question. And it's one I hear a lot as a therapist in therapy these days. How do I relate to family members who believe all the lies coming from Fox News and other right wing media? I have a family wedding in a few weeks and I am dreading it. Okay, interesting. This is another one of the things we're not supposed to touch as therapists, by the way. We're not supposed to be involved in politics, right? Which is funny because the whole act of therapy is very much a political act. Maybe not always a party political act, but very much a political act. Maybe that's a topic for another day. All right, how does someone what advice, I guess there's some advice maybe seeking in this question. How do I relate to family members who believe all the lies coming from Fox News and other right-wing media? And there's some ideas about what Fox News is and isn't there, right? That it's lying. I can't say I watch a lot of Fox News, but I'm very much aware of it. All right. What say you?
Okay, I'll take a shot at this. It's relatable. I mean, it's our culture right now. There's so much difference. There's so much opposition, and a few things come to mind. One of them, Travis, I'll say that I actually gained a lot of insight from an essay, an article you wrote in a book. Sorry, I'm forgetting the name. Reimagining Narrative Therapy, working with a client that had political views that were pretty different than your own, and you leaned into it. And there's a lot I could say about that. I've read it several times, but something that comes to mind for me is to seek understanding because I think it's really easy right now to cling to our positions And there's a lot of reason, I think, to do that. And I also think that that can quickly turn into resentment and anger. And that doesn't feel too good to hold, especially towards family members. Some of my background is in Buddhist psychology. I'm really drawn towards it. And there's like one quote, I think it's actually from Buddha, that says, Holding resentment is like drinking poison and wanting the other person to die." And that's what it feels like for me often, but this is really, really challenging, especially right now in our culture. And I think for me, just curiosity and seeking understanding rather than seeking being right is a general direction to go to. But it's really, really hard to change other people, especially political opinions. And to me, it feels a bit like a losing battle. And so I try to move from that place. It doesn't mean it's not challenging and not frustrating. And I encountered this exact scenario in my life. So I don't have an easy answer, but those are the places I try to move from.
Mhm. Yeah, I mean, thinking about the question, how do I relate to family members? So I think I would be wondering what is the goal or what is this person wanting? So if it's I want to relate to my family members, I'm hearing more like I want to belong, I want to have something in common with my family. That to me is different than I totally don't agree with them. They have to agree with my values or I don't want to be in a relationship with them. So I think it kind of depends on how we're approaching it. So I don't know if we want to belong with our family, there are a ton of other topics that we can talk about. If it's trying to get people to believe what we believe, like with Clayton, I think it's more about understanding, which some people that might be a losing battle. So I don't know if that's always a great route to go. I don't know, from personal experience, for me, it's just better to protect my energy and not engage in those conversations.
Yeah, I think there's an interesting dynamic that's coming up here, set of dynamics really, which is like, how might we approach this as a therapist in therapy? How might we approach this in our own personal lives? And by the way, there may be overlap. There may be a lot of overlap, but these aren't exactly the same things, right? And I tend to approach it or try to approach it anyways, much like Clayton mentioned, with curiosity. However, if I'm sitting with a client, that's different than if I'm sitting with a drunken uncle who's, spouting off harmful things. Like, I may handle those things differently. Now, the drunken uncle, when he's sober, I'd prefer to have the conversation with understanding and all of that, right? There's may not be much of a point of having a conversation under certain conditions, but generally, I want to operate from a place of curiosity and trying to understand. And I'll say with family, sometimes it's more complicated than that, isn't it? Now, I want to bring in this other question because I think it relates. So there was this general question about, how to navigate this with family. Someone else asked if the client's lifestyle is something I disapprove of. It can be cheating, an open relationship, sadomasochism, you name it, maybe political differences. We'll add that too. How do we answer those things? And then the person says, please do not call me biased because I am not. I am sincere. Okay. Yeah, I have no reason to doubt their sincerity. I will say, we're probably all biased, aren't we? I mean, I'm biased. I
Sure.
I don't think that's a dirty word, by the way, to say that we're biased. I think perhaps if we're biased and we make no effort to be aware of our own biases, yes, that can become problematic. And of course, none of us will be aware of all our biases. But, if we just don't care or we don't believe we have biases, now that's problematic. So I don't doubt the sincerity of the question, but I will say I hold the belief that we're all biased. It's just a matter of in what ways. All right. So what if you're working with a client and the way that the question was phrased, lifestyle is something you disapprove of. Maybe I'll expand it, not just lifestyle, but maybe beliefs, ways of being, etc. If it's something that you disapprove of, how do you handle that in working with a client?
I would still go with seek understanding. And just really allowing people to be different than you. Really knowing people are gonna have different values, hobbies, whatever it may be, and just cultures that they come from, and get curious, try to learn. Why are they drawn to this? I think something that I've learned from Lisa in regards to play therapy is every behavior is an attempt to meet a need. I think about that a lot with not just kids that I work with, but adults too. And like, what need is trying to be met here? And go to that and just really be curious and let them teach you about it. Maybe you have a bias or there's something you you think you disapprove of, and just really taking the learner's seat there and letting the client teach you about it and just really be curious. And yeah.
I agree. Couple of things I'm thinking of. One is one of my friends who is in my PhD program, when we were going through that together, he was working with sex offenders. And we would ask him, like, gosh, how do you work with them? Do you find you're able to have empathy for them? And he's like, you have to have empathy for them or you can't help them. And so he said what he does is he pictures this grown adult as a child and he learns their story and he learns what that child went through. And it gives him a sense of empathy to understand, like, this baby wasn't born with this problem or with this problematic behavior. Something happened to this person to get to this place in their life. So that was something that he said that always really stuck with me. The other thing is, Travis, you've said this before, and I don't know if it was a podcast or some writing or something, but the idea of like the bad apple. And we think like, oh, the bad apple's the problem, but it came from a system, it came from a tree. So maybe the tree is diseased. So sometimes that helps me think I always think babies aren't born with whatever, negative self talk or these problematic behaviors. So it gets developed from somewhere. So if I think about people as a product of a system or living through systems, we shape our identities and our behaviors and our choices and values through those systems. And so it kind of takes the morality out of it for me, but really just understanding what they've been through, how they've come to believe what they believe or done what they've done. I don't know, it seems to take some of that pressure off and give me some empathy.
For me, I've always experienced, and I say always, I'm not big on using totalizing language. This has always been the case for me in therapy. Sometimes it's harder to do in personal life because, those connections are a little bit different, but it serves the same effect in my personal life too. But once I understand stories, plural, and I understand enough of those stories, absolutely everything makes sense every time. There's never been something that hasn't made sense. Now, there's stuff that doesn't make sense when I don't have enough of the stories yet. So don't get me wrong, I'm confused a lot and I don't know what's going on a lot in my life as a therapist and otherwise. But once I understand enough of the stories, it's like, oh, now it all makes sense. It all makes sense. And for me, the way my brain works, or maybe that's a very essentialist position. Maybe I've been trained to be this way somehow. I don't know. But I know this is how my brain operates now is like when stories don't line up, I seek more information to try and help those stories line up. Right. And so in therapy, that's really useful for me because rather than assuming that a bad intent from the person or that they're problematic or something, what I assume is like, okay, I don't have enough information. Something's not lining up for me. And when something's not lining up for me, I try and figure out, all right, what am I missing in this? What am I missing from the story? And so that's never led me astray yet, anyways, as a therapist. Now, sometimes people will say, oh, well, then you're justifying their behavior. I'm not justifying anything. What I'm trying to do is understand. I think that's where you started, Clayton, was this idea of really trying to understand people. And as a therapist, it's a really brilliant place to be because I don't have to render any kind of judgment. I love that. I don't have to make any decisions. I don't have to render any kind of judgment. All I'm trying to do is understand another human being. And actually, for me, it takes a lot of pressure off to just. I'm not a judge. I'm not adjudicating anything. I'm not a lawyer. I don't have to care about any of that shit. Right. All I have to do is try to understand another human being and try and understand maybe what makes them tick. And human beings are complicated and they're also fabulously interesting, you know? And so it's a great honor to be able to do that with people. And just because I don't live my life the way they choose to live their life, that's okay. By the way, that's okay outside of therapy too. You know, like I live my life the way that I live my life, and the way I live my life today may not be the way I live my life tomorrow. Who knows? And the very things that I think that, oh, well, I don't live my life like this. Like the way the question was, something I disapprove of. I don't know. I'll push back on that a little. I mean, we all disapprove of things, but I think you gotta be careful with that because sometimes you might disapprove of something and then you might find yourself in a different set of circumstances and now you're doing the very thing that you once disapproved of. Like that's happened to me too many times in my life to count, right? Where if I'm not careful, I'd be too quick to pass judgment on someone. And for me, the role of the therapist isn't about judging things. Now, that doesn't mean we don't judge. I judge all the time, but it's to have an awareness of that judgment, right? Oh, that I do have this judgment. And then making sure that that judgment doesn't take over. So I actually, Clayton was mentioning from the book, Reimagining Narrative Therapy, I was working with a woman who was a Trump supporter. I actually find these interactions far more interesting than interactions where I'm more like someone that I'm working with. I mean, that's cool. Sometimes when I was younger doing this work, earlier on in the work, I liked identifying with people that were similar to me. But now I find it actually most interesting when I'm working with people who are really different than me, and they might live their life in really different ways or have different understandings of the world. That actually like gets me excited and gets me going in therapy, which I understand may be strange, but I think if we practice some of what Clayton and Lisa were both saying, then it allows us maybe to be in a place where this doesn't have to be something that feels bad or combative, or even conflictual. It can feel interesting and stimulating to be in conversation with someone who's different than you.
Can I add one thing that might be slightly controversial? I think there's certain situations where if we disapprove of something, I know that as therapists, we're trained not to share, just personally disclose much. There could be certain situations where it could benefit to be real about that too, that we might have. Like,
Sure.
I work with a lot of adolescents. I work with a lot of teenagers, high schoolers who sometimes will talk to me about stuff they're engaging in that I am concerned. And maybe it would be, to use the language of the question, something I disapprove of. Maybe that's like a high schooler who, just for an example, maybe would say something like, I love speeding when I'm driving, right? That's something you might hear from a 16-year-old. And I could, seek understanding, but I also might say like, "Hey, can I be real with you?" What kinda comes up for me internally when you say that, I get a little bit concerned. That's kinda hard for me to hear because I do care about you, and that scares me a little bit. Are you down to talk about that? And I'm bringing my feelings into the space, which is maybe something I'm not supposed to do, but with teenagers especially, I do that. And I think there has been times where I have been real about, I wanna hear what you have to say about me getting a little bit of concern or pause or disapproval about that, and, hear your feedback. So I'll do that occasionally. If it feels like it's more out of a concern than a judgment or something like that, I'll do that.
Yeah, what I'm really fascinated by is the way you go about it. The way you go about it feels like it emerges from care.
Yeah. Mhm.
Yeah, it doesn't feel judgmental. In other words, like, I don't see you rendering a judgment. What I hear happening is that you care about someone else and you're expressing that care. The way I go about that's slightly different in that I usually ask questions about it, but it's the same thing, right? Like,
Mhm.
it's, but, when you ask questions like I do, you have to, accept that somebody could say, "Well," but the thing for me is, like, if the kid says, like, "I'm gonna speed anyway," well, there's not shit I'm gonna do that's gonna stop that. Like, I have limitations as a therapist, right? But I think the point that you're raising that's or an aspect of the point you're raising that's really important is that if we see something that could be potentially problematic for the person's life and we don't say anything, right? Like another example for me is racism, when
Yeah.
racism comes up, right? And people are holding views that are actively racist. Now, one way that I could go about that is to say, bro, you're racist. Like, knock that shit off.
Mhm.
I could do that. I don't think that that's very helpful. The way that maybe it would be helpful, I don't know, but that's just not how I go about it. The way that I would go about that, it would be to lean in with some questions about that. Not an interrogation of it, right? But with questions about that and where that's come from and how that's serving the person's life. Maybe there's some blind spots around that, right? But I think to your point, or at least to your point as I'm taking it, there could be consequences to ignoring it.
Sure. Mhm.
Or if, the person's talking about cheating, an open relationship, et cetera. Like if someone's engaging in super high risk sexual behavior, this has happened before, right? And so I'll be curious and have conversations about that. Lisa, I'm wondering what you're thinking on this topic.
I'm just listening. I agree with all y'all. I mean, it totally depends. Like Clayton, what you brought up is a safety issue. And so if it's a lifestyle choice or a behavior that's a safety issue, that might be something that we talk about and express concern about. But then a lifestyle choice that doesn't hurt anyone isn't really hurting them. Like being a gay relationship, that's not, in my opinion, hurting anyone. And it might be something a therapist disapproves of, from time to time. So I think there's certain things that are okay to comment on and things that aren't. But I think mostly it's just getting curious and understanding why people are doing what they're doing or why they believe what they believe. And I think you do this really well, Travis, kind of looking at like, so you want this and you're doing this. Does that help you get that or does that not help you get that? And so kind of like helping the client look at the decision for themselves rather than us passing judgment on it.
And what's cool is I think there's lots of different ways to go about this. But I very staunchly believe that therapy is an environment where we should talk about difficult shit. Like, what's
Mhm.
what are the things we're not supposed to talk about? Politics. I talk about them all the time, so I don't remember. Politics, religion. Isn't there a third one? Sex. I think I've talked about all those already here. And so for me in therapy, I think we should talk about all those and then some. I mean, not haphazardly. We shouldn't bring them up if they're not, relevant to what's going on, of course. But I think we should be aware and ready to talk about those topics. And therapy can be an environment to talk about that, which is usually unspoken. And hopefully, in a way, like whether when I'm listening to both of you and even as much as I can, hearing what I'm saying, I mean, it seems to be that a lot of this is emerging from a place of curiosity,
Mhm.
place of care, right? And also not a rush to judgment. So I'm hearing like some themes in what's being said. So there are ways to go about this, right? That maybe have like some core unifying spirits, but the way the practices actually happen could be super different. But I think if you have some of those core spirits, what people realize is like with Clayton's story, like, oh, this dude's genuine. Like he actually cares about me. Like maybe as a Clayton, I wish I could express to my kids the way you just expressed it. I don't know if I always get that quite right as a parent because the relationship's different. And so maybe that concern I have as a parent overrides it. This is why I think it's awesome for kids and my kids to be in therapy because then they have a person that they can talk to, right? Who might express it better, which that would be an interesting question for another episode. Like I was getting my dreads twisted the other day and the daughter of May, who does my dreads, she's like 22 and she studies computer science. And I talked to her once before. She brought this list of questions this time. And she was just asking me all these questions. And one of the questions, I should have brought some of those on the show. One of the questions she asked is like, do you find that because you know all this about psychology and you've worked with all these people for 20 years, that it makes you a better person? And can you be better in your relationships and in your life and all that? And I like thought about that. I was like, I wish that I could say yes to that. I feel like I'm really lucky that I get a lot of information from other people. I see how they go about navigating difficult situations, and I think that I'm really fortunate, and that does help me in some sense. But I'm like, nah, not really. Like the same shit that I wouldn't want parents to do to teenagers. I'm sure I do that to my 13-year-old sometimes. Not because I'm a bad parent, but because I'm human. And just because I have that knowledge doesn't mean I have the wisdom to apply it perfectly all the time. Or people will assume, well, you'll be a great parent or you must be great to be in a romantic relationship with. And it's like, I'm just as complicated as everyone else is. Just because I have this knowledge doesn't make me better. But her question made me realize that, this is the assumption that a lot of people have about us, that somehow we have all of this and we can function better in the world. I'm wondering your thoughts on that idea that because you're a therapist and you have all this knowledge that somehow you can function as a superior human being in the world.
Yeah, that's funny. I mean, well, first of all, this happens all the time with I do mostly play therapy, and so I work with parents, and a lot of the parent consultations are about behavioral stuff at home. And when I'm doing a parent consultation, of course, I don't know everything, and I work with the parents to kind of find what fits for them, so I'm not like prescribing things, but I feel confident having those conversations and being able to help them find a solution or try some things. When it's my own life with my own kids, it's all of a sudden like I have no training or understanding of
Right.
parenting at all. And I'm like, "I don't know what to do." And then someone's like, "What would you tell a parent you're working with?" I'm like, "I don't know." So, I don't think it translates as well, and the other thing I found is it almost makes me feel worse about myself because, like, I know better. I should be doing better, like, in terms of I'll keep with the parenting example. I know a lot about child development and play therapy, and I've seen a lot of examples of what type of parenting helps and hurts, and so I know better, and yet I still don't do things perfectly all the time, and so it just kinda makes me feel worse that, like, there's this standard that I know I should be doing and working towards, and it's like, it's just not realistic to do that all the time, I think. But I feel like if I didn't have this training and experience and understanding, I feel like I'd give myself much more grace.
This is part of the curtain I wanna pull back on this show, to be honest with you. This is part of what excites me about this show, to have these kinds of conversations, because I think for younger therapists, they may actually think that we have figured it out, and we don't figure it out. Now, we do gain wisdom like any other human being over the years and all that, or hopefully we do, but it's complicated and life's complicated, and when we're in the fire, we're very much human, just like anyone else. Clayton, I'm wondering your thoughts about this.
I think I could say that I do think that the work and the practice of being a therapist does at least have the potential to grow you as an individual outside of as you grow as a therapist, I think you can grow as a person. And I would say that for me, like starting to do the work, I started to feel like my own like nervous system is one of my greatest tools, my own sense of presence, my own ability to my own relationship with myself can be one of my biggest tools in therapy. And that kind of led me to go a little bit deeper into some of my personal interests and mindfulness and start attending like silent retreats and those things. And that has made a big ripple in my personal life, undoubtedly. And so I think that therapy helped get me there, and so I think that in many ways it does affect my life positively. So,
Mhm.
that's what that
I'm glad you said that because I was just giving doom and gloom side of it, but that totally is true. I have learned a lot in terms of how to be in relationships or how to be a parent, communication skills and understanding of feelings. So all that has helped, but it's just I think people see it like we're these perfect people in relationships or parents, and it's just
or have an answer to everything,
yeah, not
or
that
not
easy.
no.
Last question. Does talk therapy work for everyone? This question has a second part that says, I have a client who jokingly would like me to go into his brain and change his wiring. I've certainly had people say things like that before. What do you say when a client says this? So, does talk therapy work for everyone?
Well, I think you both will know how I'd answer that. So, no.
No, end of story.
No,
I have more to say about it, Clayton.
I do. I no, I don't. I think that there's just so many different people at different unique stages of life, and that sitting and talking about a problem is not going to be the way that every individual gets helped with that problem. And I specifically found that that did not work for me as an adolescent, which is a core reason why I do alternative and creative approaches to therapy with adolescents now, because it didn't work for me. Maybe a different therapist would have worked for me, but in my experience of it, it didn't work for me. And so I try to find all sorts of different ways to meet clients where they're at in their lives. And sometimes that means not often, it means not sitting in an office talking.
Lisa, does talk therapy work for everyone?
No, absolutely not. I kinda think it's like the norm, the gold standard of therapy because it's what it's built on and it's what we know and it's what we typically do, but I actually think there's a lot of limitations to it. I mean, developmentally speaking, kids cannot benefit from it in the same way adults can, just from cognitive limitations, and so that's why we created play therapy because then it's, like, projective and they project onto the toys. Well, I feel like certain people have different backgrounds or family experiences, beliefs, and values about talking about feelings. Maybe that's not comfortable for someone or doesn't heal them. And so if we try to do that, that's not going to be effective. So, yeah, I think it's like a lot of factors playing into why it wouldn't be effective for all people. But I'm kind of leaning more towards other approaches that don't rely on that completely. Like Clayton's examples are really good. Like, with my I want my son and daughter to be in therapy for different reasons, and they do not wanna go. and they're too old for like traditional play therapy, but they do not want to sit and talk to someone. I want them to have a different outlet because they're not going to even attend it otherwise. So, like skate therapy, that would be cool. Travis, you had Jessica Stone on
Yep.
talking about playing video games with clients, and the video game is kind of like the sand tray or the playroom, kind of similar things as play therapy. I think we limit ourselves when that's our belief of how therapy works or the main way that we do it.
Couldn't agree more. I mean, and what's even talk therapy? Like when I use rap music in therapy, is that talking? Not really because it's rapping, but people would say, well, that's using words. But I think there's this idea that therapy has to be this particular way, which is two people coming and sitting in an office. One of them's the therapist, one of them's the client. And the therapist has expertise and expert knowledge in some ways and helps heal the client, right? And I won't say that that doesn't work sometimes. I think it can work, and I think it can work for some people. I guess what I'm interested in is how do we expand the idea of what's possible in therapy? And I think both of you share that in various ways. And when we do that, it's not denigrating traditional therapy. Often people think that's what I'm trying to do. I'm not. I think traditional therapy can really work for some people, but it doesn't work for enough people. And so when we expand the possibility of what therapy is, we can serve more people. Just really quickly, the second part of this question, when the person's saying that they have a client who jokingly would like this therapist to go into his brain and change his wiring. I mean, I hear this a lot too, this very sort of essentialist position. I struggle with this too when people talk about personality because I'm not even exactly sure what that is. I know psychology relies a lot on personality and personality pathology, but when someone says something like, I need my wiring changed in my brain, how do you approach that?
I mean, doesn't that just name the limitation of language itself? The client is saying this, I mean, I'm just hearing this is helping, but I want my brain to be different. And so if we're rewiring our brain, oftentimes that's not always through language. So
Mm.
I don't know, there's that piece of it. And then what I'm hearing is just a deep need for change or feeling really uncomfortable or, they're just communicating to me how much they need the change or want the change.
And maybe that they feel really stuck.
Yeah. Yeah, it's kinda like that client I told you about, the 13-year-old that's like, "I thought you were just gonna give me a pill and everything would be better." So sometimes I think it's people's understanding of therapy or change or that we don't need to be totally better, like the 100% healed question. I think, that's kind of a trap. I've had clients say that to my student counselors at my program, and they're like, "I want you to fix my panic attacks," and the student comes back, they're like, "Oh, I don't know what to do." So I think it puts a lot of pressure on, but even just having clients understand the reality of things or the process of therapy, I think can take some of that off.
Clayton, I'm wondering your thoughts on when someone says they want their wiring changed.
Yeah, a couple things about that question that stand out to me is jokingly that word was used in the question. I love humor from clients and myself. I bring humor into sessions a lot and try to keep a lightness to things. And so I might run with the joke. And I also love metaphors. Like I jump on metaphors anytime they're there. That's been one of the things I work with the most. And so I might lean into that, okay, and say like, okay, let's talk about this for a second. Here's the brain. What would you wanna change it to? What does the wiring look like? What is the wiring currently made of? What parts of the wiring would you wanna replace? What might get in and just run with it.
And what
And, like,
tells you the wiring is wrong?
what tells you it's wrong? Yeah. Like, maybe getting a second opinion. I don't know, just running with that. I remember having a client say something one time about they feel like they're a house with a cracked foundation. And we ran with that metaphor for more than, one session of just what would it look like to fix this foundation? How can you tell that it's cracked? If it looked whole and, secure, what would that look like? What would you build on top of it? What does that represent? And just to keep going. So I would kind of actually run with it, and I would be excited if a client shared that because it is a window into a metaphor, which I love.
So I'll end our inaugural Ask a Therapist Anything episode by saying both of you just asked some wonderful questions. And when I was in graduate school, I was told that I was banned from asking any questions. I was not allowed to ask questions, which never really made sense to me because that's the best way I know how to come to understand someone and who they are and their plight and all of those things is by asking questions. And boy, you just gave a great example of why I think questions can be at the forefront of an effective therapeutic practice. Because if we took that, and you're right, Clayton, you caught that jokingly piece of the question. But if we took that at face value, someone saying they need their wiring changed, right? Basically what they're saying is that, even jokingly, that they're dysfunctional in some way, that there's a circuit that's gone bad and they're beyond hope for change, right? And those questions that were just asked create hope, right? They create possibility. And that, to me, at its essence, is what we're trying to do in therapy. How do we create hope and how do we create possibility, right? And I think both of you are wonderful in your practices at doing that, which is why I wanted you on this particular episode. So thank you for making the time. I hope we get to do this again. We had, just for folks that are listening, I don't know how many, probably 50 questions or more. There's this whole big spreadsheet that our production team, Shelly and Matthias and everyone, thanks for all you do for putting that together. And we could only maybe answer 6 or 7. So maybe we can come back and do this again sometime.
I'd love to.
Yeah, it was fun.
Yeah, you two are awesome. You're awesome at what you do. And thanks for dropping not just your knowledge and your wisdom, but also your heart, bringing your heart to this conversation. I appreciate it.
Yeah. Thank you. Thanks for having us. It's great.